there was some sobering information yesterday from the Oregon Health Authority, which noted that there was a 70% increase in overdose deaths from, I think it was April and May of this year versus last year. And certainly as a group of people who come together so that no one should have to die from substance use disorder, that is tough news to take. And we will redouble our efforts and look for ways to identify community supports that can address that. But it just, again, further emphasizes the importance of this group and the collective approach we have towards substance use disorder and substances within our community. And today, the focus of our meeting, we have two special guests. We're going to look at how we're providing supports and resources for the unhoused in our community. And we're going to look at HIV Alliance's approach towards case management through peer-delivered services and prime peer in terms of what that is. So our first guest is Chad McComas, who's going to be talking about the Rogue Retreat. So Chad, I'll turn it over to you, and thank you for joining us.
Well, thank you. You're going to see my picture under Rowena Reilly, which is my assistant, because I can't get my camera on my computer to work. Isn't that great? It was working this morning, but it's not working this afternoon. And we're going to actually share a computer because she's got to put some things up. Maybe we'll figure out how to do that on one computer. Anyway, thank you so much for inviting me to be part of this. Some of you may not be familiar with Rogue Retreat. Some of you may be familiar. So I'm going to assume that you know just a little bit, and we'll go from there. Rogue Retreat is a 501c3 nonprofit organization. It was created in 1998. I was actually part of the group that created Rogue Retreat. We are an agency here in town that works with so many of you, and I look across all these pictures, and I'm so appreciative of all the people that we get to work with here in the community, including Access, the ARC, On Track, at Maslow, it goes right on down, Salvation Army, St. Vincent de Paul, the Mission, and on and on and on. We're going to try to share my PowerPoint.
Are we able to share a screen at this point?
Do we have the ability to share screen?
Yes, you should be able to.
Okay, thank you, Jennifer. She's going to put something up here, so maybe I can show you a couple things. I've got a couple of videos that I want to show as well as we go along the way. Can you see that, everybody? Do I see heads nodding? No? Yes? I see a thumbs up. Okay, so one of you see it. Rogue Retreat, we were created by a board years and years ago, and our mission we made very simple. Is our mission is to create opportunities for the homeless to have hope. One of the things that's really come to the surface is that if the homeless have a place to be, a roof over their head, then they can start putting their lives back together. And I think all of you know that. And we believe that there should be a community where people who have been homeless have a place to call home and empowered to strengthen the quality of their lives. So this is kind of a quick look at who Rogue Retreat is today. After 22 years, we've gotten to the place where we have all these different levels of housing. From the very bottom of the transitional campground that we started back in July to the very top, we have apartments that don't have subsidies, so people actually paying a full rent. And everything in between, a transitional shelter, the Kelly Shelter, which has 64 beds, the transitional housing, which is Hope Village, and we're starting a new one up in Grants Pass called Foundry Village, and soon we'll have one here, another one here in town called Heart Village, which will be a tiny house village partnered with the Addiction Recovery Center to help people with addictions, and that's an exciting thing. We're pretty excited about that. Then we have shared housing, which are go back. The other way.
I'm sorry.
How do you go backwards?
I don't know.
Okay, just click back there. There we go. Then we have shared housing, which are pretty much like, one more, there we go. We created, we took over Heather's Haven a bunch of years ago, and we've since then created Amy's and Cindy's and Harold's and the Summit House. And these are like a recovery house where people come in, they're clean, sober, and they're making good choices, have case management, and then we have our apartments. Any questions on any of that? Where we are today, we have 300 people under a roof at Rogue Retreat every night at this point. We're pretty honored to be able to do that. And these people were all homeless at one point. We want to show you a quick video that was put together recently about Rogue Retreat.
A lot of people have the misconception, that when you're homeless, you're there for a reason that's your fault. you know, but anybody who watches the news these days, I've seen them talk about the fact that so many Americans, if not most Americans, are less than $500 away from absolute disaster of being on the street. When I was first out there, I spent so many months where I just felt hopeless because, you know, the housing authority, I mean, I don't know, it was on the list, but it takes 2, 3, 4 years sometimes before your name comes up on these things. And I'm like, I can't live out here for that long. You know, I mean, I didn't know what I was gonna do. You're just in this hopeless, depressed, what am I gonna do? You know, there's nothing to do. And then I found Rogue Retreat.
Everyone's in a different place when they come in, and we meet them right there, and we try to progress them towards self-sufficiency. A lot of people, when they come in, they don't have IDs, and they don't have birth certificates or social security cards. They're not even able to get a job because they don't have the credentials. And so we get all that stuff back. We work, we start rebuilding, and it really pays off.
It's surprising what you find out you can do. This is my 4th year of school, and I've actually been homeless 3 of the 4 years. So it's been a bit of a challenge, and this is the first stress-free term I've had since I went back to school. I hurt my back, and it was just a snowball effect. You know, eventually lost my place, and then got into a bad relationship that ended, you know, with domestic violence. And WASH is a lot of fun because there's just so many possibilities, and that's what I'm about these days, is possibilities. I like to make pretty things. There's so much ugliness in this world, and I try to focus on the beauty, and I'm doing my part.
So I'm the Kelly Shelter Manager, and I'm all over this place. I oversee the staff, and I make sure things are running smoothly. We have what we need, needs are being met, and all the shelter guests are safe. I do this job because I like to see people excel and become self-sufficient. I also do this job because it's something that I'm passionate about. I was homeless at one point. I was pregnant. I didn't have anywhere to go, and Rogue Retreat helped me through that process. And now I get to give back.
This is a chance where you're in a warm environment, roof over your head, food to eat, and you get to just be off of the streets and not have that fear of looking over your shoulder. Am I going to get in trouble tonight? Am I going to be disturbed and everything? And yeah, it's just an amazing environment. But I want to get my girl and my family into a house or a home. Also, 5 years, I do plan on being a really well-known rapper here in Jackson County. So hopefully that'll turn out good.
There was a time when I didn't have a job. I didn't even have ID, let alone my driver's license and car that I have now. And I've got over 3 years clean. Now I'm looking to the next 3 years and the next 3 years beyond that.
It's bittersweet. You know, it's sad to see them go, and yet you know that they're moving on to a better life, and so you did your job, and that is sweet. That is sweet. See somebody progress and get off the streets, and you know they're going into their own life. That's what we live for. That's what we do. We did our job.
Like, there's hope for people who are still out there, and it just reminds me of where I used to be at, and so watching people get back to normal is rewarding. So it feels wonderful.
I'm from the streets, but I be coming into Kelly's shelter. I be making this my home. This is my shelter. This is my home indeed. This is where I lay my head to sleep, where I go and get my food to eat, but you don't even notice me. I'm used to being in the streets, but people don't really care. They be looking at me and they don't even wave, get out of here. I'm just a ignorant person that you can't even look at. Maybe I'm just so depressed, but man, I guess I can't quit that. That's me, Mateo.
So one of the things that Rogue Retreat has existed for since the beginning was we don't believe in just warehousing the homeless. There are programs out there that provide housing, but we want to do more than just provide housing. So we created a case management program, and it was dubbed our secret sauce by the executive director of a nonprofit organization close by. And we've stuck with that, our secret sauce. And our secret sauce has all these different levels of things that we do. Weekly case management. We have case managers that are resource brokers. We don't try to do everything. We connect them to where they need to go. We have short-term and long-term goal planning, accountability and coaching, weekly housing inspections. Before COVID, we had weekly life skills classes. And then we work with the folks on 15 life skill domains, which comes right out of the Service Point program that most people are familiar with, the Homeless Management Information System. And in there's a range of being able to assess where people are from a level 1 to a level 5. 1 is when you're in crisis, 5 is thriving, and our whole program was wrapped around that. And we start clear back down to the campground. When we get people in there, we start working them through our program up to our apartments. And so case management is the key for everything that we do. In 2019, we had these results. Should be the next screen. There we go. We served 459 people. We had 180 gained employment during that time, and then we had 70 households that graduated from our program, moved on to something better. And this is funds that we raised in 2019. I want to show you another quick video. This one is Hope Village, and Hope Village was created in 2016. We built it. 2017, we opened it on Halloween, which is coming up this Saturday. We'll have our 3-year anniversary. But Hope Village has been the scene of a lot of people coming from outside our area to see how we do things. We took some of the best practices from other villages that we'd seen around the Northwest, put them into practice and added our case management. And now we have an incredible program that serves a lot of people. We've had the mayors of Oregon in, we've had city counselors from other cities, we've had commissioners from other counties, we've had university presidents all come and see Hope Village. And I think you'll enjoy this quick little video that was not put on by us, but put on by a group out of Chico, California.
As a city, we were looking, so what can we do to help our homeless population? The city of Medford does not have a great big budget, and so cities like ours rely on nonprofits or outside entities to say, you know what, I have an idea.
The goal with developing Hope Village was to, one, win over the community, to explain what a tiny house community is, address the fears and the concerns that the community has, and then show them through practice in day-to-day operations that a lot of the fears and a lot of the stereotypes are not true. And if you create a structured environment, you can have a safe place that works.
There was a lot of concern from the council on this is going to be the one-stop shop for every homeless person to go to. And this is where the education part comes in.
This place is not like laziness. They are very strict. You got to do your chores. You got to do your gate watch. So there's no intruders in and out of there. And you got to do your chores by keeping the place looking clean. Each one of us has a certain thing we have to do. And then myself or 2 others will check the job they're supposed to be doing. And once that's done, we check it. And then when a meeting comes, they want to know, well, how's the chores? We look at it, it's just fine. Everybody's doing what they're supposed to do. And when everybody's doing everything right and tourists come in, the place looks clean. Everything's fine the way it's supposed to be.
As you notice, one thing about Hope Village is we intentionally tried to make it this way is it's peaceful. It's just there's a serenity here that it just feels good to be here. There's just this feeling that this is a community, and it is. And it seems like when you have something nice, that the people who live here want to keep it nice. Now, what we also did was we wanted to have the option for the people here to learn how to garden. So we actually created a piece of the land down here that is a community garden. And for most of the people that are here, they haven't had that opportunity to have a garden, or they don't even know how to garden. But they're learning. It's kind of exciting. I was just talking to somebody a couple minutes ago. We still have some tomatoes down there. So they said, hey, we can put that in our tomato sauce tonight when we have spaghetti. I said, yeah, that'll probably taste so great. So we're teaching them what to do with things like that.
It's good. When I first got here, I didn't know what to expect. And little by little, I started to get used to the place, that people are nicer. better, and then they started to help me out, and I was starting to feel better. I had my head up, and I talked and made friends here, and they also made me a counselor.
What we provide is relationship-based case management, where the case managers are working with each individual to develop action plans that are unique to that specific individual. But within that structure, we have a 5-level system that we do to measure self-sufficiency. And so when people first come here, we're beginning to look at, do they have their ID? Do they have their birth certificate? Do they need these things? And making sure that they have the essential documentation that we all take for granted to be able to live their lives day in and day out. And then once we have those pieces met, then we begin looking at, okay, do they have addiction issues? Do they have mental health issues that need to be addressed? What's their credit score look like? What's their employability? And we begin looking at their the different barriers that they might have and how we can begin addressing those. But each case plan, as we work through that 5-level system to getting somebody self-sufficient, is tailored to be specifically unique to that individual, because all of us are unique in our own way, and we all have our own barriers and we all have our own struggles.
This is a transitional program. This is for people that want to essentially reintegrate themselves, back to having an income, whether it be a job or, collecting what they, through like disability, collecting an income and getting back on their own feet.
When people first come here, their first 3 months that they're here, they are paying a $60 a month program fee for Rogue Retreat. $60 a month is pretty obtainable. And then after that 3 months, we then do a $100 increase on that. So it becomes $160 a month. And 50% of that increase then goes into a trust for that client. And so the reason why we did that is because Hope Village is meant to be transitional, but we also are not interested in just warehousing people. We want to be able to move people along. So we had to create a process through that program fee that would make it a little bit uncomfortable from time to time, so that people would begin taking those next steps to beginning transitioning into something more permanent. One of the best things that we want to be able to do is we want to be able to provide that sense of hope and provide that sense of dignity. And so that's part of the vision of creating Hope Village, is that it's a place that provides people's dignity, because we're getting people when they're at their bottom, and from there we want to be able to build them back up. And so providing a place that is aesthetically soothing, that they can be proud of, that's all part of that ingredient of providing a place that's dignified, that they have a vested interest in seeing succeed, and creating this community dynamic where everybody is building each other up and making each other a better person as a result of it.
We try to be protective, help one another with food and problems, all this and that, where it makes it a better community. So it's a good place to be. Should be something like this other places too, so they can be off the streets and get help.
The people at Hope Village did a great job of bringing to the council the types of people that would be living in these homes. People that just had a bad break. For so many people in Southern Oregon, the people are living paycheck to paycheck, and sometimes people lose that job for whatever reason. They don't have the savings to keep staying where they're staying, and they're just really good people that don't have anywhere else to go. So when they're bringing those people very emotional stories to the council, I mean, that really, I saw it for myself. I saw some council members flip from being against it to saying, you know what, let's give it a shot.
This is something that every community could afford. From the fence to the grounds to the tiny houses themselves to the community structures that are shared areas with the kitchen and everything else. Our total property, we've invested just over $600,000 into.
Just in perspective, the average homeless person uses the emergency room 4 times a year. Now, if you know anything about emergency rooms, just to walk through the door is $1,000 probably. So they're probably going to spend $1,500 to $2,000 for each visit. So if you take that average person 4 times a year, they're going to spend maybe $8,000 in that year. And if we got them here in the village, they're not going to the emergency room. And they're putting their lives back. And right now, as I mentioned earlier, over half the people here are working, which means instead of taking from the community, now they're working and they're putting taxes back into the community. I think that's a win-win, don't you?
So I had a couple more slides and then we'll get into maybe some questions and answers. You folks are pretty familiar with this, but homelessness in Jackson County is growing. We saw a 15.6 increase in homeless population in 2018 over 2017. We don't have the most current numbers, but it is not going down. Before the Alameda fire, we had a 1% availability of rentals on the market. Now the crisis has been exacerbated by 2,000 homes that were lost in the wildfires. So homelessness is not just going to be the chronic homeless, it's going to be all the other people who lost their homes. Chronic homelessness, people have been homeless for one to or more years. We saw an increase of 32%. In March of 2019, Eco Northwest reported that in Jackson County, the homeless population hit a 7-year high. And while Oregon's population represents 1.3% of the total U.S. population, Oregon's homeless population represents 2.6% of the total U.S. homeless population. So we have more homeless people in Oregon than a lot of other places. What are the leading causes of homelessness? You guys are familiar with this. Lack of affordable housing. What's out there they can afford even if they are working. Lack of a livable wage. Recently, it was determined that an average 1-bedroom apartment in Oregon costs $900+ a month, which means you'd have to make $17 an hour to be able to afford a 1-bedroom apartment. How many people in Jackson County make $17 an hour or more? And that $17 an hour is actually representing that you would only be paying 30% of your income for rent. And many people are paying far more than 30%. Another reason for homelessness is domestic violence. That happens quite frequently, and COVID has just increased that. Medical bankruptcy leads people to homelessness, and mental illness and addiction lead people to homelessness. And most of these are not things that people choose. They just happen to people. So why do we want to help the homeless? Well, when we give hope to the homeless, it leads them to become thriving people with job stability, and they rise out of poverty and they give back. At Rogue Retreat, we encourage people to live a life where they don't have to have subsidies. You know, HUD has that line, if you make $1 more, you don't get any more housing subsidies, you don't get any food help, you don't even get medical help. So a lot of people are encouraged to stay living below that line of income so they can keep getting those services. If they rise above that line, they're on their own, but life actually begins above that line. So we encourage people at Rogue Retreat to crash through that line and work 40 hours a week and become the manager and maybe become the owner of the business, become able to take care of yourself and be self-sufficient instead of depending on other people. So at Rogue Retreat, we really encourage people to move forward. Currently at Rogue Retreat, we have a staff that's nearing 70 people now, and about 20 of those people that work for us full-time were in our program at one time or another, and now they are working full-time and helping the next person get that hand up out of the well of homelessness. Are there any questions that people might have?
I don't see any hands up yet, Chad, but can you talk about, like, if you were given your magic wand, what would be the next steps that would support your guys' work, and what would you like to see in our community?
Well, there's no doubt that we have to continue to create opportunities for the homeless to have housing. Because if we get them housed, then we can start getting their lives back together. So my magic wand, one of the dreams that I still have is to have a permanent community where we could have people that are going to be on limited income the rest of their lives, and they're either seniors and they only make $500, $600, $700 a month. That's not going to increase. They need a place to live out their lives and not have to be worried about the rent going up or being evicted. And the other one is we deal with a lot of people that have disabilities. They're not going to be able to increase their income. They're not going to be able to go back to work. So we've got to create a permanent place where people can live out their lives. There's a great example in Austin, Texas called Community First. If you went to Mobile Loaves and Fishes, MLF.org, and look that up, you can see their Community First. We've got to have at least 1 or 2 of those here in Jackson County that we can help people get involved with. It might be an RV park, and they have a mixed RV park in Tiny House Village. I think the more we help the homeless, the more we're going to help our community. Because when the homeless are happy and healthy, then everybody else benefits. Did I answer your question, Eric?
Absolutely, absolutely. And this presentation was outstanding. I think, Chad, the experience that I've had in the community is that your guys' I mean, again, we should focus on the incredible need they provide and that they answer in our community. But your places are clean. They're nice additions to our community. And that's kind of one of those touches that I really appreciate. So thank you for you and your team's work around that.
Well, I think, Eric, one thing we've learned along the way is there's a difference between a location where you hand out food and clothing and blankets and those type of things and versus our housing. And in every one of Rural Retreat's housing programs, we don't have services for people that are not living there. So they're like gated communities, like you might find in the East Hills of Medford. You're only going to get through that gate if you live there. And if you don't live, there's no reason to stand outside the gate because they're not going to do anything for you. So if you go try to find Hope Village, if you've never been to Hope Village, you won't find it. It's hard to find. And if you've never been to the Kelly Shelter, you have no idea where it is. And if you haven't gone to the campground specifically, you wouldn't know where it is because you're not going to find shopping carts and drug deals in the parking lot and all that kind of stuff. You're just not going to see it. And that's what we have to do, I think, to help the NIMBYism is for people to see what can we do to actually help the community instead of hurt the community. And by the way, I want to give an invitation to anybody watching this today. If you would like a tour of Hope Village or the Kelly Shelter or our campground, just call our office and we'd be glad to set you up for a tour because it's kind of interesting to see just how special these places are. And Eric, I don't know if you've been to all of them, but it's really worth the visit.
Not all of them, so that'll be on my list. So, Chad, thank you so much for taking time today to share with us. We've had this on our wish list of presentations, and it certainly delivered. So, really appreciate that.
Thank you, Eric.
All right. Oh, we do have a question. Excuse me, Lenita, go ahead.
One question. Access for recovery programs before COVID were many weeks wait, and I wanted to hear what that looks like now with COVID and with the fires, seeing our suicide rate, overdose rate rising so much. What's the status of access for recovery services for your clientele?
That's a great question. And now and since I see a representative from the ARC and also a representative from OnTrack, they could probably answer that better than I can, because we would be resourcing people out to these great organizations because we're not going to redo what they do. So I don't know if Kim and Eddie want to respond to that.
Well, actually, Dr. Wood, if we could wait, they are on the agenda for a little later to give us updates, and we'll kind of have that inform some of those updates, hopefully. Great. So.
Yeah, but we couldn't live without them. I just want you to know that.
All right. Excellent. Okay. Well, thanks so much again, Chad. I do want to move on to the next step. Amanda McCluskey with HIV Alliance is going to share about the case management work and peer work that they're doing and what that can look like for our community. So I know this was less than a month's notice, Amanda, but hopefully that's enough. And thanks for joining us.
Plenty of notice. Thank you for having me. I'm going to share my screen if that's all right. I've got some slides. Okay, well, thank you so much for having me. So I'm Amanda McCluskey. I'm Program Director at HIV Alliance. And like Eric mentioned, I wanted to come and speak to you all about Prime Peer, which is something that HIV Alliance is working on in a number of counties. So I wanted to tell you a little bit about that. What I wanted to go through today was just a little bit about HIV Alliance. So I know Dane comes to these meetings, so I'm sure that you've heard a bit about us. So I'll keep that pretty brief. But and then a little bit about our current staffing, the Prime Peer program, what that looks like in the counties we're doing that, and what we're hoping it'll look like in Jackson, and then our next steps. So, all right. So I'll just start with about HIV Alliance. So we started in 1994, and when we originally started, we were serving just Lane County. So over the last, 25 years, we've really expanded. So now we're serving 13 counties in Oregon, doing case management for people living with HIV and doing prevention services to prevent new infections in 8 counties. So our mission statement for HIV Alliance is supporting individuals living with HIV and preventing new infections. So everything we do sort of, comes back to that. So we have offices in Lane County, Marion, Douglas. We have staff in Jackson and Deschutes counties in the health departments there. And then we have an office in Josephine as well. So we're all over the state, and the level of work that we do varies by county. So in Jackson County, we do HIV case management. We do PrEP coordination, which is pre-exposure prophylaxis. It's a medication that folks can take once a day to prevent getting HIV if they get exposed. And then we also distribute naloxone. We do that in partnership with the syringe exchange that you all have there in the health department in Jackson County. This is just a little bit about our philosophy. We're very harm reduction focused, strengths based, meeting people where they're at and helping folks build the tools and access the tools they need to meet their goals and get to the next step in their progression. These are some of the healthcare services that we offer. And this again varies by county. So in Jackson County, we have a pharmacist who can work with people living with HIV, and we have a nurse who can work with people living with HIV as well. The rest of these services we offer in different places. So it just varies. So anyway, so our peer support program. So we've been doing peer support for a little while. We've been doing the OR Hope program since 2017. That's a program we've been doing in Douglas County in partnership with OHSU, and it's a research project. And we're looking at the impact of peer support specialists working within a syringe exchange program to help folks access treatment and also prevent overdoses. So that's been a great project. We just expanded that to Josephine County. The program has also expanded to Coos, Curry, and I can't remember the other counties, a couple more, but that's been very successful, and we've certainly learned a lot doing that work. We also have peers in a housing program that we have that's specifically for people living with HIV. So that housing program currently is serving Lane County. We're looking at expanding that to Douglas, Jackson, and Josephine in the next year. So specifically for people living with HIV, and that offers them a peer support specialist to work with them, as well as access to behavioral health and HIV case management and a lot of wraparound services. So that's really targeted toward those hardest to house clients that we have and working to get them into housing. So we also started offering peers at our syringe exchange in Lane County. We're just looking at rolling that out in Marion County as well. And this is not associated with OR Hope or Prime, but these were peers. We were sort of piloting what is this going to look like when we offer this at syringe exchange. So it's been going very well received. So this program specifically that we're talking about, we're looking at bringing, offering this in Jackson County starting in January. So this is what's called Prime Peer. And this is funded by the State of Oregon House Bill 4143 in response to continuing opioid use. And initially it was operating in 5 counties, now it's expanded. So we started offering this program in Lane County a couple months ago. I'll tell you more about it when we get further into it, but we're essentially working with folks who are at risk for overdose to help prevent overdose and then help them get into treatment when they're ready. So we're currently doing that in Lane, and we're working on that, implementing that in Josephine County in January as well. And we'll be looking at Jackson County in January too. So our target clientele that we're looking for is we're looking for folks who need substance abuse treatment, especially those who have experienced overdose or at risk for an overdose, but aren't quite ready to get to engage yet. And these peers, one of the unique things about this program is that these peers are not associated with a drug treatment program. So a person doesn't have to be enrolled in treatment to access these peers. This is sort of for when folks are not quite ready, but maybe at risk at overdose. So we can help them with naloxone, overdose education, making sure that if they're injecting, that they're doing it safely, and sort of put in some of those things in place as we help them move along the continuum toward treatment.
Amanda, if I could just gold star that little point real quick, because I think we've had conversations locally for a long time about how if a person was not quite willing or ready to engage with a particular program, they're really left without services. So the idea that we could stay with somebody, meet them where they're at, and provide supports till maybe they do reach that place where they're ready for a different intervention, regardless of which agency they're with. Really, I think that's been a need in our community. So I'm excited to see that be a focus.
Yeah, thank you. Yeah, that's absolutely. And that's what we've been seeing with the peers that we have working in our syringe exchange programs a lot, is that it's really helping those folks who are ready, not quite ready, sort of not really sure how to navigate, and helping them them get to the next step. So that's great. So we're looking mostly at getting clients for this program from community linkages. So from hospitals, corrections, detox clinics, substance use clinics, wherever folks need us, especially folks who maybe are falling out of care at substance use or at detox, you know, and then need some help to get things back on track and get back in. We're also, and to clarify, engagement with substance treatment is not required for this program. So we can take folks who are actively using, who are not quite ready to stop, and work with them on whatever they need. So we're hoping to target people after contact with emergency services. And as I talk more later on, that's really going to depend on, you know, the partnerships that we can build and the needs of the community as well. So in Lane County, we've been able to set up connections with or partnerships with the care management teams at the hospitals. And so that's what we'll be hoping to do here in Jackson County as well. So if the hospitals or emergency rooms are seeing folks who have overdosed or have a history of opioid use and need that sort of assistance, that they could make a referral to us. So we'll be working on building that up. And then we'll be connecting folks to services, resources, care, whatever it is they need, whether that's hepatitis C treatment tends to be a big one that we work with folks on. And then a lot of basic needs resources too, housing, food, transportation, that sort of thing. So we use peers for this, and I think you all know this, but peer support specialists, they share the life experience of the clients. And we found this, you know, we've been doing case management for a number of years, but have found that the peers really bring this unique perspective and really unique ability to connect with people who are going through a potentially intense time in their life. So having that extra level of connection and empathy has been very helpful. So the services they do, it can range from practical help, like giving people a ride to a doctor's office or helping them navigate insurance, but also other things like role modeling and moral support and just saying, yeah, I totally understand where you're coming from. That's hard. And then also referrals and linkage to care as well. We really, basically the peers kind of do whatever they can do, whatever is necessary to get the job done. That's basically what they do. And like I said a couple of times now, we're providing services to folks who are not quite ready to access treatment, but are sort of working in that direction. We use a lot of motivational interviewing, a lot of engagement, a lot of support, and a lot of really just positive reinforcement. Like, you know, yeah, this thing maybe didn't go the way we'd hoped, but we're glad you're here today. We're glad you're still talking to us. We're glad you're engaging in the ways that you're engaging. So in Lane County, we started this program, I think I want to say August or September, and we have 3 peers and 1 coordinator, and we're co-locating the peers in emergency departments, as well as taking the referrals from care management teams. We're also taking referrals from corrections. And our connection with syringe exchange has been a big piece too. So our peers spend time at syringe exchange, work with clients there. You know, all the times that I've been at syringe exchange, there's frequently a few folks who are talking about wanting to access detox or access treatment and are ready, but just don't know the steps and don't know how to get connected. So it's been really helpful so far to be able to have these folks there at syringe exchange ready to connect folks to care. In Josephine County, we're looking at having 1.5 peer and a lead peer. And in Josephine, it's going to look a little bit different than it looks in Lane and a little bit different than it'll look in Jackson. And I'm just telling you this to give you an idea of what we're looking at. But in Josephine, we're looking at they have a local planning group for their peer programs. So we're looking at taking a leadership role there and helping to explore where are the gaps and where are more peers needed or less peers needed, or where's the overlaps. And then we're exploring partnerships with emergency departments and corrections there as well. So prime peer in Jackson County, We are looking at bringing on 2 full-time peer support specialists and 1 full-time lead peer. Those positions are posted on our website now. So if you know of anybody who would be a good fit, who's looking to do this kind of work, we would love it if you could share that with them. We're hoping to serve about 100 clients. And that's, to serve 100 clients, we'll have contact with probably 2 or 3 times that many. But there are some folks who sort of fall in and out of care as time goes on. Our lead peer, we're hoping will coordinate with community stakeholders and advisory groups. We're planning on beginning with Medford and then expanding across the county as much as we can. We're hoping to partner with the hospitals and corrections, possibly do some co-location, and we'd love to be able to enroll clients at discharge from the hospital. And then we're also working with Jackson County to do some co-location at the syringe exchange there as well. And we'll be, our peers will be coming to a couple of the things that we have staff doing now. We have some staff helping out with Compassion Highway and distributing naloxone kits there. So we're hoping to be able to have our peers come to that and distribute the naloxone kits and a few of the other places that we're doing that at. So for us, for our next steps, we're hoping to roll this out in January of 2021. That is our goal. We need to define and refine our referral process, get our co-location places set up, do some community engagement, and explore partnerships. So that's one of the ways in which you all can help us. If there's places that you think we should be working with or looking at, I would love to know about that. And let's see. So that's my contact information. So if you have any questions or thoughts or ideas that you want to share with us, that would be wonderful. And I don't know if there's any questions.
Question. So Amanda, just a quick question. As you've brought these programs up to speed in communities, have there been unforeseen barriers or challenges or things that you've worked through, lessons learned?
Yeah. I think some of the lessons learned have been that the hospital staff are very busy. So they're wonderful and they work very hard and they're busy. So it's hard for them to refer folks as much as we would hope. So we've tried to create some really simple referral processes like a cell phone number and a fax machine, and however you get information to us is wonderful. So we're really trying to set up really simple systems. We've also found that, we know some of the folks who are presenting at the hospital are also presenting at Syringe Exchange. So that's a place where we can get folks if we don't get them from the hospitals too. But those are so far. I think we're just in the building phases of our relationships with corrections. So while I'm sure there will be lessons to be learned there, I don't think we've gotten quite there yet. So,
okay.
Yeah.
All right. Any other questions for the group for Amanda? All right. Well, certainly so grateful that you guys were able to come and present. And I think this is really timely and I'm really excited for it. Sarah Smith, who co-chairs this group, and I think she's going to try and join us, has talked about that. Just how important that is when people aren't directly engaged with an entity, to be able to have some support, somebody that will follow the person. And maybe it didn't work here, but they still follow them. And maybe it didn't work here, but at that point when it clicks, to make sure that somebody's supported and really just kept alive and valued and engaged. I think that's huge. So I'm really glad you're going to be doing this work. Thank you.
Thank you for having me.
All right. Don't know if Tanya or Jim Shames were going to be able to join us today from Jackson County Health and Human Services. I see a no. They have been on full-time COVID duty for quite a while now, and I know that takes the majority of their time. But as we move to our local provider updates, I believe last time we went alphabetical. So this time, if Recovery Cafe Reclaiming Lives would like to kick it off and give us a local update, I do think that if everybody could keep Dr. Witt's question in mind about as we've seen COVID and the fires, how has that impacted access and how has that impacted people's the supports they've needed through this? So I think those would be great if possible. But again, Reclaiming Lives.
Hey everyone, nice to see everybody on Zoom, Stephanie and Brandon. So we continue to be open with our 11 circles a week, serving about 130 people. And we're going at about half speed to try to keep the numbers in place for COVID. So wearing masks and in the cafe, still having a good time, but it's a little bit of a different way of doing business, I'd say. We are looking to hopefully bring on some daytime circles, which would provide opportunities for people who are not available in the evening or can't make the times that we're open. So we're excited about that. We have a new volunteer, John Bain from Phoenix Counseling, volunteers a day a week with us and does one-on-ones, and he's been amazing for our team. Really does a lot of support around goal setting and personal development and those types of things. Also works with our staff and has been a really great asset to our team. So it's been awesome to have him. We are also working with the governor's called Oregon Solutions Work Group on a new project. It's modeled after Project Rebound in California, which is basically a project that helps people who have been incarcerated or are coming out of incarceration engage in higher education and trade schools. And the recidivism rates around those folks who do enroll in college is really amazing. So we were tasked with interviewing 10 of our amazing people in Jackson County that are affiliated with our organization and many of yours who are leaders in our community to ask them what the challenges, barriers, and successes have been in their college experience. And this allowed us to create a report that's going to go back to the governor's office as part of their assessment of whether or not this is a viable project to roll out statewide. So we don't know the results of that yet, but there's some anticipation on that being a potential project that we could be a part of. So we're excited about that new avenue of service. Also, we just, I don't know, continue to serve an amazing group of people and are encouraged by the efforts that are being made by the people who do come here and the lives that we're seeing changed. And Brandon's going to talk just a little bit about one of our members and the work that he's doing on his recovery.
Love you guys. It's been a little bit since we've seen everybody's faces here. I sure hope through the times that everybody's coping pretty well. We have a gentleman who came in and seen us. I'll give you his first name. It's Rob. He was broken. He was living on the bike path. He was staying in cars to stay warm. The thing about him is he held his job all the way through his addiction. When we asked him why, he told us that criminality wasn't something that he was familiar with and something he didn't want to turn to. So even through his disease, he continued to work. Well, he came up and seen Stephanie and I literally at a low point. It's getting me emotional. So he came in, he told us, we talked with him, and I asked him, the one question, what are you willing to do? What are you willing to change? He said anything. And that's when I started rubbing my hands together and I said, okay, well, let's get busy. And right now, this gentleman has now moved to a new job with longevity. He is now a member of Oxford House. He's a volunteer here at the cafe. He now, every time I see him, his haircut, he's got brand new clothes on. He's always smiling real big. First, we got him over to Rogue Retreat, which Justin and Chris, thank you guys for helping us along with that. And we got him with the livability team over there, got him into the urban campground, and then they put him into the Kelly shelter, and then he went from there into Oxford. So that's just the networking that we get to have here at Reclaiming Lives, where we get to work with just magnificent teams and just watching this guy grow every time. Like if I need him right now, if somebody calls and say, hey, can you come do dishes tonight? He's there as soon as I hang up the phone. Smiles on his face, ready to go, even after a 12-hour day. This is the reason I love doing what I do, is for providing hope just like that. This gentleman's amazing, and I love being able to come up to LADPC and talk about another magnificent story that just never seems to fail, and the smiles on the faces. Like this is why we do what we do. And candy corn.
2-pound bag.
I
would say you guys,
oh, go ahead, Justin. Yeah.
I would say you guys are definitely making headway throughout the community. You guys have definitely set the pace. and you guys are doing amazing work. So keep it up. Thank you, Brandon and Stephanie.
Thank you.
Thank you, Justin. We love you, man.
I want an app on my phone where I can hit that app and Brandon Orr will tell me an inspiring story for like 90 seconds and it'll just like recenter me. That is awesome. Thank you.
So, hey, Eric,
Yeah.
stay tuned.
All right. Thank you guys so much. I also want to make a note. Commissioner Strasser has been so committed to this group, and he will continue to be. However, today he is getting pulled over to a secondary advisory group around wildfire. And so if he has to leave us at 4, I just wanted to make sure that folks knew he was very apologetic about missing, but he is getting pulled in a number of directions as our community is facing a number of issues and concerns. So Lisa, did you have a comment?
I just wanted to also give kudos to the Recovery Cafe. They are a tremendous support to our treatment courts, and we just love Recovery Cafe. And the support that you give our participants is outstanding, and you are such a valuable resource to our community. Thank you so much for the work that you guys do and the service that you provide our community. Thank you.
Thank you, Lisa.
Thank you, Lisa. We love your people.
Yeah.
They love you.
It's amazing.
We love you. Thank you.
All right. I haven't seen Susan Sanchez from Providence today. And I haven't seen John Boehm from Phoenix. I do think Susan would be a great person to have eventually as one of our speakers to talk about the provider group that she's been able to spearhead. Just kind of changing or how about this? Just kind of supporting those providers locally who are looking to deepen their involvement with MAT and resources around that. That's been a major change in our community over the last 2 or 3 years, and she's doing a lot to support that. Eddie, I can kick it over to you though with On Track. So thanks so much.
Hey everybody, thank you, Eric. It's great to see everybody's faces. Things are going well at On Track, very busy. In Jackson County, our Medford outpatient services are open for in-person or phone assessments, treatment, etc. The moms program and the dads are both relatively full. We still have to adhere to OHA rules in terms of residential capacity, but we have been able to slowly increase as we get further and further into the year. Of course, there's still waiting list at both places, but we always encourage people to check in, get that assessment done, because anybody who runs a wait list knows there's a lot of shifting that can happen for any number of reasons. In Josephine County, Grants Pass outpatient is open as well, and we're moving to our new Cave Junction office location, opening November 9th. So we're getting ready there. We're renovating that office space, and we did open the residential facility, Mountain View Recovery, up in Hugo. So the current clients moved in last week, and we're up to 11. We'll be able to get up to 16, hopefully in pretty short order. And that's the Josephine County update. And as far as what Dr. Witt was asking, yeah, our numbers are steady, and we have been able to serve clients who are at the Rogue Retreat, the campground, and Kelly Shelter. Most of them go into outpatient, but we've also been able to get some into residential treatment as well. So we are making some headway there, and the peer support team, which is really Alex Spray, is doing some great work in both places. So optimistic news there, but we could always be doing more. And happy to answer any questions, but that's the update from here.
Thank you, Eddie. Really appreciate that. And there is some amazing work getting done there for sure. Let's see. I don't think Kristen is here from Oasis. Kyle Gray, Medford Treatment Center.
Thanks, Eric. We've had a lot going on. I'd like to start with, we are now open. We opened our doors September 21st. So there's been a lot happening here. As of today, we are currently serving 100 clients in just a little over 30 days. So our admit process, we've been doing a lot of admits. We're really trying to improve our processes and our flow with the influx of clients that we've had, but 100 people in a little over 30 days it's been a lot, but it's been exciting. So currently we have 15 staff members, 2 doctors. One thing that's really exciting for me is we're partnering with the state of Oregon and the University of Washington in a contingency management program focusing on stimulant use. So along with our focus on opioids, we are also doing some studies on the reward systems and how it affects stimulant use. So we've got a lot going on, and I'm just really happy to be open and participating and helping people in the county.
Well, and Kyle, I appreciate that. I think that even within parole and probation, we're going to try and look at the contingency management piece, because it's something that, honestly, I think as a system, we haven't done real well. It's like, well, I gave them a subway card, and we don't often know how to really utilize those techniques to help people as they work through the earlier stages of substance use disorder, particularly as it pertains to methamphetamine. So thank you for being one of those sites that's really going to take a lead on it. And hopefully we can bring those trainings and supports to all of our community, because I think it has a lot of promise right now.
Yeah, and some of our work that we're doing is going to be worth, for government reporting and future funding, and it's going to be a little bit extra on our staff, but we're happy to do so because these numbers are very important, for what we do and how we do it.
Thank you. Appreciate it, Kyle. I do see that Kristen Johnson is here from Oasis. So Kristen, can you give us an update on how things are going? Oh, hi from Oasis. My computer mic is not working. I'm sorry. I will update via chat box. Okay, certified nurse midwife and on staff. This is kind of a fun way to do it. No problem, Kristen. Thank you for the update, and we'll look to check in with you next meeting. Thank you, though. And those who want to read on the corner there can look at the chat box. Julia Pinsky, I had a meeting yesterday with the Oregon Health Authority, and I said, you need to take care of Julia. They said, have you talked to her recently? And I said, well, no, it was about a week and a half ago. They said, I think we're doing okay. So I put them on notice for you. I hope that helped. But do you have any updates from Max's mission?
Appreciate that a lot, Eric. It all helps. So we are part of the technical assist that the OHA is rolling out with a harm reduction clearinghouse that is going to come very, very shortly, any day now, I think, and will be open to many of the people, as part of this meeting. But until we get finalized details, we really can't say how that's going to work. But it will be quite exciting. So with that, we've been working on that. Our boxes in Jackson and Josephine County have been very busy. They are used regularly. We don't feel they're being abused at all. But it's and we hear, we get messages. People call us when they're empty. People say thank you. You help save, you help save my son's life. And so I think it's a really good program. We know that. And as well as that, naloxone by mail is consistently busy. So that is also a good thing. We will be in Albert Park on November 12th, and we are looking to expand out in rural areas a little more with mobile naloxone. So that's about it. And we're at the Resource Center, of course, 2 days a week, 12 to 3, Mondays and Wednesdays.
So grateful for you and the work you do, Julia. We asked, we wrote an article about the Resource Center here in Corrections, and we said, so just how many folks have reported saving lives based on naloxone from the Resource Center? And the answer is 24. So 24 people have said that they deployed naloxone to save a life just from the corrections piece. And we still have a lot of work as a field to try and destigmatize use of naloxone and build comfort amongst our clients that we supervise to say, hey, your life is first and foremost important. How can we get there? But Max's mission has been just willing to get out on the front with us and say, hey, how can we help? And I'm so grateful for that. So 24.
Thank you.
Yeah.
We're grateful to be there. It's, we really feel like we're able to make a huge difference for a lot of people, even being there just a few hours a week. It's incredible.
Super good to see. So thank you again. Sarah Smith, I have you down under La Clinica, but every time I know there's different hats you wear. So if you have other community updates, Sarah, it is yours to share.
Well, thank you, Eric. The two hats I have today are La Clinica, naloxone work group. But look, for La Clinica, I would just say or remind people that we have 18 waivered providers, people who can prescribe buprenorphine. We have about 120 people or so at La Clinica doing that. We have more than one midwife who can prescribe. And speaking about COVID and the fires, you know, there's a lot of aid out there and it's rather fragmented from what I can see. So we have a behavioral health team of people that can help navigate the opportunities and help people with, you know, all the stuff that comes with access to special help. So I think that's about it for that. Did you want me to mention the naloxone work group?
Yeah, that'd be
Oh,
great. Yeah.
I mean, the main thing for that is just that it brings people together, many of whom are already a part of this group. So I'm not going to repeat anything, but I think a chance to share information, learn about things like the harm reduction supply, clearinghouse, stuff like that. It helps us to be together. Kelsey Smith-Payne from OHA will be at the next meeting to talk about the harm reduction supply clearinghouse. So if somebody wanted to attend and they don't normally do that, it's the first Thursday of the month from 9 to 10, and you can just send me an email or something and we'll get you in.
Awesome. Thanks, Sarah. Is Cynthia here from Copia today? No? Okay. Dane, our local HIV Alliance update, if you have that for us.
Sure. Through the first quarter of this year for us, from July through September, we distributed about 366 and intermuscular kits, 144 nasals, working with Max's mission. We have had about 27 reported reversals done in Jackson County, and that's through clients. In that first quarter, we average about 9 a month that are reported to us. The other thing we're trying to capture is we were encouraging our clients to give a kit away to another at-risk individual. So we've given about 31 kits, and the kits all have really good training of the 6 steps, and we're encouraging them to train their partners with the 6 steps also, but the kits are self-inclusive there. You know, we're still seeing huge increases, and we do syringe exchange in Josephine County, and over last year, we're seeing about a 400% increase. We did increase our grants pass. A lot of that has to do with, we went to grants pass from doing 2 Thursdays a month to every Thursday a month. The peers working with Oregon Hopes, which Amanda was talking about earlier, has really impacted that. The peer is right there on site. She has developed a great relationship with our syringe exchange clients. I know from, you know, what she's doing down in Josephine, we did in Douglas over the last 2 years, and about 20% of those people were connected to some sort of care through that peer program. So I think that's really a positive on those peers working through syringe exchange, connecting with those clients. So we're excited to see, especially with the increase of what we're seeing in Cave Junction for services and also grants pass, because we've seen a huge increase in Cave Junction also. But Josephine County is about a 400% increase over the 19 time period for that first quarter of our year. So we are still seeing some fentanyl reactives. We're waiting for the clearinghouse. We're going to be one of the training partners with Julia and Sarah also, and encouraging people to apply for that. They're a 501(c), and more information will be forthcoming here soon once they get the website up and running, so that other agencies can order the same harm reduction supplies that we can, which includes naloxone. I want competition with naloxone. I want people to be distributing it just as like we are, because then we can save more lives. Because that information that came out from OHA is just very concerning that, you know, overdose deaths are still happening, and we can change that. I think what Julia does, what we do with naloxone in Jackson County, can really make an impression. So if agencies have at-risk clients that need naloxone, we're always happy to partner and come in and distribute naloxone. So just reach out to myself, and we'd be happy to assist in any way possible. And then we can connect you to the clearinghouse to order those same supplies, tell you how we do trainings. We're always happy to share our paperwork so you can collect data such as the overdoses, the reversals. I mean, I think that's important data to capture, and we're always happy to supply that. But that's pretty much what's going on and what we're seeing down in Jackson County. But I think everybody on here is just doing so many great things. And I really liked that first presentation because I live in Roseburg, and the city of Roseburg is looking at modeling that same and capturing that same program here in Douglas County, and it's much needed in our rural Oregon. So it was exciting to see the videos and today. So thank you very much.
No, thank you for your feedback and for your work. I think that, the longer we have these conversations, it sounds crazy, but the less revolutionary they are. 2-3 years ago, it's like, oh my gosh, folks are having, or even now, folks are having boxes with naloxone. And the more these become our community norms, we really look at what the health needs are for people who are, living with substance use disorder. And I appreciate everybody willing to take those steps initially, because it makes it a lot easier once they become established. So thank you. I have Dr. Brandon Lynch down for Boulder Care, but I believe Justin S. is our updater officially. And so if Justin, if you want to speak to Boulder Care, but Brandon, you're certainly welcome. We always love having you here. So either way.
I won't interrupt Dr. Lynch by any means if he wants to talk.
No, I'll say that you're right in assuming that, Eric. I think Justin's the correct representative and
the proper deferment.
That's right. He's more up to date than I am too.
Hey everyone. Right now with Boulder, we continue to meet the unprecedented need that we're seeing. Word of mouth referrals are, that's kind of primary where we're seeing. We've been, of course, busy with participants that we gained through the wildfires and then, of course, the aftermath. So we continue to see people. For this year, so far, we've enrolled 100 people from the area. And I know that we'll see more. We're headed into that time of year where we see people with more and more needs, and just to remind ourselves and of course everybody else that this is what we go through, and we'll be ready for it with you guys.
And Justin, we should probably put you guys on that old agenda item coming up too, because it really is amazing that people can utilize telehealth to engage in services, and some of the older beliefs we've had about how it wouldn't work or you need that personal touch, you still get that personal touch. And while I'm longing for the time when we can all come back together as groups in rooms and see crowds again, I think that some of the lessons we're carrying from this are just how effective these interventions are, particularly because it meets people when they need it, and literally where they're at, because they can get it via phone. So
absolutely, there's nothing like talking to somebody that's using the Wi-Fi from a Starbucks that's unfortunately they're in their vehicle or maybe not at all, but they're still able to have a one-on-one conversation. I'm still able to invite them into my house and give them the care and connection that they need.
Right. So
thanks.
Thank you very much. Jody Reel from Allied. Is Jody here? I don't see her. But I will kick it over to Kim Ovison. So the ARC, Kim.
It's good to see everybody. I feel so lucky. I was coming into this meeting from the Greenway meeting, and there's just so many amazing collaborations that people are doing. This county is pretty great. So some updates. We recently, in fact, I think her first day was yesterday, hired a psychiatric nurse practitioner to join our team. So we have Kellen Marshall, who's just joined us, and she'll help round out some work that's happening in our mental health department as well as our addiction medicine group. She's also ex-waivered, so that's a fantastic addition. We have another QMHP, Janice Witt, who's joined our team. She's been with us a couple of months, and I couldn't remember if I mentioned that. So that's another really great piece of news for us. Chad talked a little bit about Heart Village, which will be located behind Mason House, which is our residential on 8th and between 8th and Main Street. And so we got some much needed ground prep happening. So there's lots of foliage that was taken out and cleaned up. So we're well on the way. We're pretty excited about that. Some changes that have happened. Karen McLean, who many of you know, who's been the face of our outreach in a lot of ways, has become a 911 operator over in Grants Pass. So we wish her well. She told me when I came on a year ago, I'm going to be a police officer. That's my goal. And so I knew that was coming for her. So Ben Spence has picked up much of her work and holds that very valuable phone and phone number that anybody can use and reach out. So we haven't missed a beat. We'll keep moving with that. But we are moving to hire in that place. Let's see. Just to respond to Dr. Witt, we do have a wait list for sure, but what we know is that the wait list fluctuates depending on whether we can connect with people or not. So we meet weekly with a full team of people. We call it our transition meeting, and we discuss whoever's on that wait list, and we work with our peers to connect with everybody that's on that list and keep massaging it and working it. So it can be anywhere from a day to get into a residential unit, or it can be weeks. It just kind of depends. And you kind of heard that from Eddie as well. Let's see, we have 9 residential beds for females and 15 for men, 7 in our detox, and we have 9 CRMs, peers that are working all those programs at any given moment. Those are our reductions because of COVID, so many of you have heard us talk about that. I was pretty excited to hear Amanda talk about HIV Alliance, so I reached out to her already, and so we'll start connecting because we're up in the hospitals as well, so it's going to be great to have that extra kind of support. And I think that's kind of all of my updates. One thing I wanted to put out there, I'm part of an ECHO. Many of you maybe have done ECHO through OHSU, and I happen to be on a particular one, and they were talking yesterday about this overdose, the increased overdose that you mentioned, Eric. But they were also talking about how fentanyl is showing up in the methamphetamine as well now, and that there's some, this was the first time I'd heard this, maybe you all are up to date on it, but there's some kind of thing that's happening with fentanyl that's causing such a rigidity in the chest that sometimes it's taking 7 to 10 doses of naloxone to rescue people. And that was the first time I'd heard that. So I was just thinking, Eric, it might be great if we could get somebody to come talk to us about some of the, things that they're seeing now. So, yeah.
That is scary, Kim, and I appreciate you saying that. If there are other recommendations for speakers, particularly ones with expertise like that, one of the golden or silver linings of COVID is that, we can get a lot of experts here. So yeah, we'll see if we can reach out. So thank you. All right, CCO updates. I don't think Darren or Julia from Jackson Care were going to make it, but we have Jeffrey Piacitelli. And Jeffrey, I'm going to ask you if you would be willing to share the amazing link you sent to me around contingency management in the chat with this group. That would be outstanding. I appreciate it right now, but welcome.
You bet. Hi, Eric. Hi, everybody. I will send that link here shortly. Can everybody hear me okay? I'm having some phone issues.
Sounds
great.
Good.
Thank you. All right. Not a whole lot to update on. The flow of folks with substance use disorder presentations to the hospital has been steady. I feel like a bit of a broken record, unfortunately, but we're averaging about 5 substance use disorder presentations a day between Jackson and Josephine counties at various hospitals, both regionally and locally. It keeps me very busy, and I'm outreaching to various partners for follow-up with those folks. We have had a bit of an increase of hospitalizations for folks who were affected by the fires, and here at All Care, we're making sure that when I am able to identify those by way of the hospital notes, that we have care coordinators reach out to those folks within 24 hours of their presentation to see if All Care coordination can do anything to help support or assist folks who were affected by the fires. I think that's about all I have to report. Yeah.
No, I appreciate that, Jeffrey. And folks want to look in the chat side. Hopefully we'll get that link about contingency management and build a little bit of, I won't say fire, build some momentum around that for our community. So, all right. I'll save OHA updates till the end because I was given them in writing as our partners could not make it to this meeting today. But Andrew, you have got, and I see Sam is here as well, some Oregon Recovers updates and information.
Cool. Thanks, Eric. And it's great to see everybody. I know I've said this on past calls, but I want to reiterate how impressed I am with the Jackson County LADPC. It is so refreshing to see this level of collaboration and coordination with all these stakeholders. If only the rest of the state could be doing what you guys are doing. I will breeze right past electoral politics and ballot measures and happily. But I want to focus on some stuff that's going to be considered in the legislature in the next session that I think is important for you guys to know. Oregon Recovers is actively building a coalition of stakeholders to push a bill called the Addiction Crisis Recovery Act in the next session. It's kind of the culmination of the last 3 years of organizing work that we've been doing. Representative Sanchez is our chief sponsor. We have a senator that's interested in maybe being the chief sponsor on the Senate side, and we have a number of champions on both sides, in both chambers, that want to carry it. Ultimately, what we're talking about doing is raising the price of alcohol by X percentage, whether that be 15%, 20%, we're not exactly sure, because standalone, that is a public health measure, right? Like, we know if you raise the price of alcohol by 10%, you're going to see a precise reduction in overall consumption, but more importantly, a really high reduction in underage drinking and binge drinking. So just like the tobacco tax, or similar to the tobacco tax, it's kind of the best practice for mitigating the harmful effects and consequences of alcohol consumption. But arguably equally as important is it's going to generate a ton of new revenue. And, we've spent the last few years really supporting the Alcohol and Drug Policy Commission in a planning process. And last February, they finally released the Alcohol and Drug Policy Commission statewide strategic plan to address the addiction crisis. And we're now at the point where we want to, begin to fund and implement that plan. The plan's effectively a blueprint for a new continuum of care in Oregon, focuses on prevention, treatment on demand, recovery support services, and kind of has a guiding philosophy of moving our intervention and engagement paradigm upstream into our education system and our primary care system, as opposed to downstream in our criminal justice system. So we're advocating for a significant price increase in alcohol that would fund the implementation of this plan, in effect. And just to point out, 3 years ago, 2 years ago, in the Capitol building, you ask most legislators, and they would tell you that this is impossible. It's a losing issue. There's no way this is ever going to happen. It's lost many times in the past. That is absolutely not the case anymore. We've built quite a bit of political will within the legislature, in large part because of the advocacy days and the other events that we do, where our local advocates have an opportunity to meet policymakers and talk with them about their personal stories. Even last year, the governor said as much. This is a losing issue and she's not interested. Well, that's obviously changed because it's in her budget this year for her next budget cycle. It's very clear that this has become a major priority for folks. And I'm really proud of that, because I think in large part it's because of our organizing work, but more importantly, it's because of all the advocates, from Jackson County and Deschutes County and everywhere else that have taken the time to really make this issue a priority for their legislators and their elected officials. So one of the key differences between what we're proposing versus Governor Brown's, and just so you guys know, we are communicating, we're meeting with Jeff Rhodes regularly. Additionally, I just had a call yesterday with Oregon Health Authority, and we're all on the same page and recognize that a unified strategy is really important. Their proposal is certainly more modest. I think it's solely a beer and wine tax, and it would generate about 250 to 300 million in the next biennium. 10% of that would be invested into prevention. The remaining 90% would be invested in treatment and recovery support services by way of Behavioral Health Advisory Council recommendations. So it's focusing on both mental health and addiction, whereas our proposal is focused more on creating a new continuum of care for substance use. But either way, this is a huge step of progress. The fact that this is, being seriously considered at the executive level, and then of course by us. Additionally, as kind of a backup, we're going to reintroduce our recovery center network bill from 2 sessions ago that would create basically 15 different recovery community organization drop-in centers around the state as kind of like central hubs to provide recovery support services, or beef up and increase capacity and funding for existing centers where they already exist, like in Jackson County. But the important thing here is we want to create a system in which there's more handoffs and communication between treatment centers and recovery around the state so that folks are kind of seamlessly passing from one level of care to the next. And this is all going to be in our Addiction Crisis Recovery Act bill, but obviously we want to have some contingency plans in case we have to resort to that. We have some other bills kind of ticking on the alcohol industry as part of our strategy. I'm not going to get into those details, but just know that we're opening up a bunch of fronts, recognizing that this is going to be a protracted battle. Lastly, and this is really important, Representative Solman is introducing a bill, a restorative justice bill, that would create automatic expungement and conviction classification reduction. So it'll be looking at moving folks that are in recovery with felonies down to misdemeanors to expungements. And I think we're meeting with her next week to also talk about maybe looking at some of the DUI stuff, because as you guys know, having a lifetime ban on your driver's license is really challenging, and it's a big barrier to long-term recovery. So we want to ensure that there's kind of a pathway for various folks that have been impacted or justice involved to get on with their lives and move into recovery. Also, I think in the last time we met, I was talking about a lot of the engagement we've had with the Oregon Liquor Control Commission. They had moved unilaterally to allow home delivery, among other things, and then made those rules permanent without really consulting anybody in public health. And so we really kind of raised hell about that and got a number of legislators to write letters and got some news stories, covering it. I'm really happy to say that since all of that, the OLCC is now including us in all of their rules advisory committees, but more importantly, they're including the Alcohol and Drug Policy Commission in that process and OHA's Public Health Division. And they now have a public health impact statement that they have to analyze with OHA and the ADPC for any rule changes regarding alcohol or cannabis moving forward. So it's huge progress. Not, it's not the end all be all, like that's not the solution, but it's definitely a step in the right direction in terms of getting OLCC to start considering the public health implications of some of their rulemaking processes. So that's pretty cool. And then I'll let Sam talk about the Oregon Recovery Network. We've got some exciting updates there. But then also, if you guys, we're holding weekly briefings, I think starting the week after the election on the Addiction Crisis Recovery Act. So if anybody's interested in attending a briefing, learning more about that, participating on the strategy table, moving forward, email Sam and he can, and I'll put his email address in the chat function right now, but he can, get you connected with our next briefing. Go ahead, Sam.
Hi, everyone. Thanks for having me here. Yeah, so I'm just going to tell you a little bit about Oregon Recovery Network. And I believe Andrew's introduced it to you all before. But just to give a brief rundown, right at the start of COVID, we recognized that there was sort of a drastic reduction in access to services, whether that's meetings or treatment or access to peers. So we built out this site as like a central online location where people looking for any sort of resources can find them. And so we have pages for online meetings, and we're working to transition those as people are moving back to meeting in person. We also have listings of peers, listings of sober housing, as well as treatment and detox centers across the state. And so all that is crowdsourced. So we've received submissions from treatment centers and other people across the state. So we're able to add all those meetings and keep the site updated in terms of what treatment is available and the different availability of services as that changes. And so if you're not listed on the site, or if you've been listed on the site and you do have any updates in services, we have links at the bottom of the homepage of the site and at the top of each of the individual pages, including the treatment page, where you can submit different resources and we can get those updated on the site. And as this has gone along, we've tried to continue to improve the site. And one big thing that we just added is we just added a chat function that'll help people navigate the site more easily. And also we have another project we're working on where we'll be able to connect people directly with a peer through that chat function. And we've developed some different peer partners throughout the state that are able to accept those referrals that we receive through the site. And so if any of you have peers on staff and are interested in joining that program, you can feel free to email me. I believe Andrew put my email in the chat function, and I can get you connected with our project manager, Rachel, and she can talk to you about what sort of that partnership entails.
Great. Thank you, Sam. I don't believe we got to hear back from you guys after the Oregon Recovers Recovery Summit because, Andrew, you may have been big game fishing out there at that point during our last meeting. But any lessons learned, I've really appreciated it. It was that connection. And while I can't wait to get back in person, I was just grateful that it actually happened. And anything you guys can talk about regarding it?
Yeah, for the record, I caught the biggest salmon in my life that day. It was enormous, and so I was quite proud of it. I think it was, like 28 pounds or something stupid.
It looked photoshopped. I saw a picture. It did, right?
It did. I still have a freezer full of salmon. So that was, we had to pivot rather quickly to an online summit, and we didn't know what that was going to look like. I'm really pleased with the turnout. The enthusiasm was really cool. Obviously, it's never going to have the same community building feel that the in-person event the previous year did have. The big benefit that I saw was the geographic diversity we had was way better because you didn't have to drive to Eugene and stay in a hotel for 3 days. And so people from all over the state that probably wouldn't have been able to come otherwise were able to attend. And we were able to bribe people with a ton of CEUs because you could watch them retroactively and just keep racking up hours. And so there was a really good incentive there. It was a lot of fun, some tech difficulties for sure. And I think now that we've done it, we know, where to make improvements and we can do it pretty seamlessly next time if we have to do it again next year. But I'm really hoping we're back in person by then.
Well, I personally, when I see Tony and Mike and say Autumn, and your whole crew get up there and talk, I just get that kind of inspiration and pride. I'm like, yeah, they're fighting the good fight. So it meant a lot to me to be able to still attend even remotely.
Well, and thank you guys so much. Jackson County really kind of came out big with your, you guys had your own shirts and like the photo collage. That was so cool. And that means a lot to us, honestly, working up here in Portland, especially now when we're not really able to see people in person, and to see you guys, take it to the next level like that is just, it really means a lot to us.
Cool. Well, thank you both very much. Last update I have is from OHA, and Samantha Byers sent me an email where she wanted to just mention Prime Peer, which we got an excellent introduction from HIV Alliance. Sobering Center for the ARC funding is out, and there were some initial funds, so they feel they were able to kind of help strengthen that. CARES funding is almost distributed to those recovery organizations that applied. One of the things that I've been involved with a little bit with the Department of Corrections is the way we evaluate treatment programs, which is a little bit odd in itself that corrections would be auditing or trying to influence treatment, but trying to find a way to partner with the Oregon Health Authority to make sure justice-involved individuals have the responsive, culturally appropriate services they need that are also evidence-based in a way that doesn't make treatment providers say, I don't want to work with that program at all, because we've been that influence in a lot of communities. So there is work being done. And if you have input on that, let me know and I can help connect you. The ADPC, Alcohol and Drug Planning Committee, is working on initial strategy to develop a governance structure for the multi-agency work ahead. And they have a suggestion, and it might be for us at our level, is that we start looking at service element money that gets spent in Jackson County with interested providers, and put a utilization plan together that could then be sent to Oregon Health Authority for review. Our county is a little bit unique in that we gave the expenditure authority for service elements back to the state, and there's a number of reasons for that back in the past. But with that, do we still have a voice? Because service element money is really supposed to be that money that can do things that none of the other funds that are more directed can. And historically, we would look at that like, how can we use service element money for people who are uninsured? And as insurance coverage started to expand, I think that conversation changes it to how can we use service element money for those things we know that are extremely important to the treatment and recovery process, but aren't reimbursable. So that shift, I think, really can carry some weight in terms of how people are served and how we do those things within our agencies that we're like, yes, that would make a big difference. So hopefully I'll have a little more conversation with OHA about what that could mean, and they can come and present at one of our next meetings about how service element money works and what it looks like in Jackson County. Folks, that's our agenda. Did anybody else? We did have a spot on our agenda that said other updates. Are there any other updates we need to know about or something that somebody has to share? Well, don't tell the other meetings, but it's pretty much my favorite meeting of the month, and I appreciate all of you so much for being willing to come and share. It is one of those touch points that kind of helps energize me. So,
Eric,
yeah, Jennifer.
We do have a quorum. I didn't want to
still
interrupt
do?
all the presentations, and conversation. But if you wanted to do the minutes, we can do that.
Let's do it while everybody's still online. We will do one last order of business, which is the approval of the minutes, and we do that through a roll call vote. Certainly it was sent out to all of membership. I would entertain any discussion about the minutes or corrections. Hearing none, I would entertain a motion to approve the minutes as written.
So moved.
We have a movement from Michael Malley. And who did we have a second from membership? Justin Hahn. We have a second. All right, Jennifer, if you wouldn't mind putting us through a roll call vote.
Sure. Jack Adkins.
Approve.
Dora Best.
Present. Approve.
Approve. Okay, thank you. Let's see. Ron Dunn, I don't believe has joined us. Okay. Eric Geyer.
Approve. Thanks.
Got it. Justin Hahn.
Approve.
And Amanda Eisenhower had to leave. Rosemary Jernigan.
Approve.
Okay, thank you. Lisa McCready.
Approved.
Michael O'Malley.
Approve.
Heather Philp, I don't believe has joined us. Nick Wrighton.
Approved.
Sarah Smith.
Approve.
Okay, thank you.
And just for the record, although Justin was the early leader on Best Background, Nick Wrighton did have a child appear, which is unfair. But Dorit Best, with that photo of the pond behind her, might be our winner. That's pretty nice too. So thank you all again, and we'll get together in a month. So thanks.